All right. Hi, everyone. Thanks for joining us. I am Lauren Tancredi. I'm the practice development lead here at Hint Health, and I'm excited to be here with Dr. Bree.
Hi, I'm Dr. Bree Seefeldt. I'm talking to you from Denver, Colorado. I put on my wig today just to kind of shake it up a little bit for everybody. I am bringing back my Northern California roots since we can't be in San Francisco, bringing them into Colorado because we can also not be in Colorado together. So I figured I'd bring the fun back, which was the reason I went into direct primary care and something that I hold near and dear to my heart. So I'm happy to be here with Lauren talking to you guys about delivering a remarkable patient experience.
Amazing. I love the wig. I was saying to Dr. Bree, I knew I would have coordinated so that we could definitely spice things up, although it's been getting really spicy this morning on our session. So glad that you guys have been here, that you continue to join us today. And I'm excited to share with you some insights on creating and delivering a remarkable patient experience. And in my work with clients, I would often hear them say that they provide excellent service to their patients. And while that might be true, I want to make sure that you understand there's a difference between providing service and creating an experience. And I want to be clear that this is a distinction, right? And so customer service is defined as an act of helpfulness. It's something that you do, and as DPC doctors, you've committed to doing for your patients. And a remarkable experience, in my personal opinion, right, is a well-orchestrated series of events, right, that leads to a lasting impression on someone. And I invite you to consider that it's not just the service that we convey, but it's all of the things that make the experience. The setting, so all of your physical office space, your staff, these are the people that you put on your team. You hope that they align with your values and that they're conveying the same cadence of communication and commitment to your patients that you're extending, as well as your clinical protocols and follow through, just to name a few. And we only got 20 minutes, so we could go a lot of different directions here, but we're going to try and stay really concise for you all. And so before we get into some of the details, I want to share with you 4 things that we see as core efforts that great companies across a variety of industries consider when they're thinking about how do they create these experiences for their customers. So the first is that they keep their focus on their customers, right? And if it's not their main focus, then none of the other things that we talk about today. So if you're not working to keep your patients and for most companies, customers, then nothing else will matter. The second is that they're working to find new customers, which in most businesses happens through their existing customers, in your case, patients. This is the largest driver of practice growth that we see on the Hint platform. And it happens through referrals, right? So if you're not creating a remarkable experience for your patients, then what are they walking away or walking out of your office thinking, and more importantly, talking about? The third is that you're providing new opportunities to engage your customers or patients. The reality is that health is an ongoing journey. It's not something I can just give you my credit card and boom, you have health, right? If it was only that easy. So just like your car needs a mechanic, a patient will forever be a consumer of health. How they consume it is a different story, which makes number 4 important. We want to be as efficient as possible in your delivery of the services that you're offering. So here is where we underpromise and we overdeliver. We teach patients how to be with the practice. And this is just as important for you as it is for your staff. I'm going to ask you to lean into the people that surround you here, because it's not just about you that's delivering care at the end of the day. But I'll let Dr. Bree talk about how a remarkable experience actually shows up in her practice.
Absolutely. Thanks, Lauren. What I have to kind of convey in this talk today is that it's not just about delivering award-winning customer service or having a 5-star review or always pleasing the customer necessarily. Those are things that we think about with customer service, but in my experience with direct primary care, the remarkable patient experience is created by the care that I deliver as a provider and that my clinic delivers as a system for that patient. It is about advocacy, service, and compassion. It starts with allowing yourself to have a remarkable experience caring for your patients. Remember that most of our patients have never been exposed to direct primary care. Most people, this is their first experience. So you're teaching them about it and how to receive care in this experiential fashion in a way that's unlike anything they've ever had before, which means that you also get the opportunity to have that remarkable experience caring for your patients again. And I know there's residents and there's students and there's doctors that are not in direct primary care yet that are in the audience. So this talk is for you too. It's about how to re-engage with your patient in a way that brings you joy, because that's what brings the remarkable patient experience. So this is how it works. Here's a couple of stories from my practice. Bob's labs came back with an A1C of 9.5. This is not normal for him, and you suspect it's because of the stress going on in his personal life. So you set aside time, because you know you have to call him. This is not just about his sugar. Juanita always gets UTIs, but this time you walk into the office and she looks sick. You send her for imaging because this time you think it's something different. And this time it's a perinephric abscess, but you know her, and that's how you knew. Bridget is having episodes that you swear are atrial fibrillation. You refer her to cardiology and they dismiss her stories as palpitations, and she feels really discouraged. She comes to your office one day and says, "My heart woke me up at 4:30 this morning." And you say, "That's not palpitations." You put on your EKG and she's in atrial fibrillation. So you call cardiology, you send them your EKG, you do the labs that they want, and you get her an appointment the very next day with somebody who's ready to listen to her story. This is direct primary care. This is what is a remarkable patient experience, because we know our patients. This is what advocacy, service, and compassion really looks like. So if we look at advocacy, it is creating an experience for your patient. It is allowing your patient to have a different doctor-patient, provider-patient, clinician-patient interaction. Advocacy is how, in direct primary care, we help patients navigate the system and the maze of healthcare. It's disorienting on a good day. We fight for the care that our patient needs and deserves. We find the best cash paying prices for labs and imaging and prescriptions. That's advocacy. We understand what drives your patient, what fuels them. We also know who supports our patients, and if our patient doesn't have any support, we know that. And that's what helps us advocate for what that patient needs. That's what creates the remarkable patient experience that's tailored to that individual. Having a referral network that you know and trust is essential to delivering this care.
And like Dr. Bree said, advocacy is creating the experience. And so this doesn't stop at the clinician. Your team has to know how to show up for your patients, and you too. This is a new experience, not only for your patient, but also for your team. You're introducing DPC to everyone. And so it's important that you communicate your values so they can be extended through you, just like a cadence of communication throughout your brand.
And that's where we get to service. We think of customer service in the traditional model. The bar is really low, really low. So it's easy to think, oh, this is easy. I mean, like all I have to do is be like a little over that bar and people have a completely different experience, which is true. However, service is delivering that true new experience for your patient. It's about being available, being flexible, being responsive to your patient. It's about listening, because let's be honest, patients want to be heard. Some patients, the remarkable patient experience of direct primary care is having their labs reviewed instantaneously. But other patients, they need you to go line by line, because the chloride of 107, they're going to be Googling it and they're going to be worrying and they're going to be going down that rabbit hole. So there's some patients I know I cannot send them their labs until I have the time to go line by line with them through it. Some patients want to come in and out of the office in 10 minutes. Some patients don't want to come in at all. They'd rather just have the call from their office. Other patients need 45 minutes and they're craving the face-to-face time. So we have to know how to pivot and how to meet the customer experience that that patient wants.
Yeah, like Dr. Bree said, I mean, service looks different for every single patient. And so again, this is where you get to under-promise and over-deliver. It's not your job to please everyone. You also get to enforce boundaries and continuously teach the patient how to be with the practice. The more that you set forth your expectations, the better job you'll do in satisfying through service, right? And more importantly, your team will know how to show up and empower those actions. So it's your job to pivot. and to understand what's needed in any given situation. Here's where we're anticipating the needs of the patient, right? And so we can do so many things. Like if they're sitting in the waiting room for a little extra time, how do you extend a drink of water and make them comfortable? It's like, these are the little pieces of secret sauce to the customer service that helps people feel relaxed, comfortable, attended to, and really feel the value of the direct care offering that you're bringing to the table.
In fact, Lauren, this year, my medical assistant took upon herself to give every patient a Dove chocolate at the end of their blood draw.
Aww.
It's so cute. And they love it. It's like the simplest little thing. She's like, oh, here's your chocolate after your blood draw.
I love that.
It's so easy. This is about compassion, and compassion is ensuring the patient experience. Compassion is understanding and validating your patient's lived experience of their suffering. This is what medicine is. This is the art of medicine. And the beautiful part of direct primary care is you get the time to do that again. It's not about dismissing your patient, but it's also not about overindulging them either. It's about having boundaries so that you're not hand-holding everyone, but you're empowering them. And in fact, I have that sticky note on my computer. It says, do not handhold, empower patients. Because it's important. In fact, direct primary care, in my opinion, is even more important when you value your own needs as a provider. This is the reason we're here. This is why you're listening. This is many people in the audience right now. I have to say, when I saw 25 to 30 patients a day in a traditional model and an owned practice where I was owned, I was employed, but I like to consider it owned because that's how it felt. And when I was in that situation, I could not value my own needs. I could not give the compassionate care to 5,000 patients. So I was stuck as a new mom with 2 kids at home and an EHR that had been rolled out poorly and 5,000 patients. I could not give the compassionate care that is true to my heart. And so I started to burn out, and I was only 4 years into practice. So I thought, this is not going to work. I have 2 choices. I can give less quality care, or I can take care of fewer people. And so many of you in the audience are looking to change that. In fact, I would argue most everyone in the audience is looking to change that. That's why we're here. And that's the important ingredient of creating a remarkable patient experience, is creating a system that values you and your staff and your providers in your clinic as much as it values the patient and the customer. Because if we are valuing ourselves and it works for us, we create a business that works for us, then it helps our patient too, because we're full in our bucket, so we can help other people. It is not always about the traditional Western medical model of find it, fix it, make it go away, write a prescription and get them out the door. This is about taking patients' health, taking it seriously, and teaching them about it. We can help patients understand what is going on with their body. I wore these earrings in honor of my patient, Janice, because she gave them to me last week in a visit where I spent time with her to help her understand that her knee problem that she has thought is a knee problem for the past 4 years is actually a hip problem. And she went to the orthopedic surgeon. He took one look at her knee and one look at her hip and said, it's your hip, and sent her out the door. And she did not believe him. She did not believe him. There was no way that he was correct because he spent no time with her and she couldn't wrap her head around it. So I brought up the images, brought up the x-rays, brought up her knee MRI, and we brought up pictures on the internet and we talked about it. And I said, this is your hip. It's not your knee. And it was because I had the time to do that, that created her remarkable patient experience. And she gave me a gift.
So much power to deep listening. And like Dr. Bree said, it's really the place where we get to ensure that they're having a remarkable experience. And a lot of times people get met with complaints, right? And it's like, oh my God, this person's complaining again. But what if a complaint was an opportunity to just show a deeper level of compassion? Really, right? And so we look at great brands, and one of the ones that I like to bring up is the Ritz-Carlton. And again, we're not talking about 5-star experiences here, but what they do really well is that they empower their staff to anticipate the needs of their customers. This ensures that the experience is remarkable, and it also invites the customer back for more. Again, self-propagating business model here, right? And essentially one of their rules among many of their tenets is like, if there is somebody within 12 feet of any employee that is standing within their facility, they have to acknowledge it, that person, right? And so many times when I go into prospective clients' offices, and even sometimes in DPC offices, does somebody look up from the front desk to just greet me? They know I'm coming. My name's on the calendar. My appointment's there. Like, what a simple hello will do to just like bring warmth into the conversation. And as you think through these elements of what actually makes a remarkable experience for your practice, what sets you apart, what makes you very different in this commoditized world that we live in, I would argue that it's not what you offer, but it's how you offer it. This is the behavioral differentiation that is the sustainable competitive advantage in your practice. And as Dr. Bree mentioned earlier in the last slide, compassion starts with you, right? And so I have a couple of clients that I coach and they're doctors, and I keep telling them, put on your own oxygen mask. You cannot save the plane, right? So find compassion for yourself first, so that you can serve from that cup of overflow, that you can extend it out into others, both your staff, because how you treat them is going to be an example of how you want their patients to be treated, and for your patients downstream.
It's not that we don't want 5-star reviews. That is certainly wonderful. I'm a very big fan of 5-star reviews. However, it's important to know that that remarkable patient experience is not being available 24/7 and overextending yourself to the point where it disrupts your personal life. It's not about pushing your own agenda on other people. It's not about engaging in a control battle with the 5% of your practice that drives you crazy. It's not about having no boundaries just so somebody will say something nice about you online or in a 5-star review. And it's not about having the fanciest bling in your office so that immediately upon opening you look fancy pants, but having overextended your overhead so much that you don't survive. So don't do that. Don't let being perfect on your opening get in the way of the progress of the care and the true experience that you are going to give to your patients.
And like Dr. Bree said, like we're constantly in a conversation of teaching the patients how to be with the practice, what the expectations are, when new tools are being rolled out. And so communication is so essential in order for people to understand how they get to be with you, how they get to be with your staff, and how they get to receive the care that you're offering, right? And so it doesn't have to be perfect the first way. And you get to integrate new tools, technology, and people to help support you along the way. Your job is to be a great advocate and communicator of how that gets to happen for people. Because again, DPC is new and there is no one way to do it right.
I always love when they say, when you've seen one DPC, you've seen one DPC, because that is exactly it. And the nice part about DPC is we get to be malleable and we get to change. So for example, in my practice, we've had a newsletter, a YouTube station, a blog. We've had Facebook Lives. We've done a book club. We've had parties when you could do stuff like that. We, this year, developed a collaboration with a local nutritionist to run another detox program and kind of a jumpstart after COVID, because it's been a tough time. And again, those collaborative efforts in our community to reach out to other providers and other expertise is what helps us to be successful too, to deliver that remarkable patient experience, but without it always being dependent on me as an individual. So I can take the time to reach out and to make those community connections and to bring that in for my clients and our customers, but I don't always have to be the person to do it all, which is a mind shift change and also a sustainability factor, right?
Yeah.
So, I have to say that direct primary care has been lovely because I get to, 4 years into this practice, say that I don't have any burnout at all. I am back to the joy of medicine, which is, hence the purple hair, bringing the fun back, so that we get the opportunity again to participate meaningfully in the lives of other people. That is a beautiful thing. And as Lauren mentioned, we want to be great companies, right? That's why we're all here trying to butter ourselves and figure out how do we make our DPC even better. So that's when we get to remember those tenets that Lauren brought in the beginning. If you build the job that you love, your patients will feel it. And they'll be a part of your experience, then they're going to go tell their friends. That's how you keep the customer and find new customers. That's the authentic growth of a relationship-based care model. If you advocate for your patients, you're going to get better outcomes. So your ratings will be fabulous, of course. And that's your opportunity to engage the customer. If you have compassion for yourself too, in how you build your business, then your business will be sustainable. And that's how we become efficient, by not overextending our own energy. And with that, I think we're ready for questions and answers if there are any.
Amazing. I think you hit the nail on the head. Like, this doesn't stop at you. You get to incorporate your team, the vendors that you're using, your cash pay partners. Like, people are hungry to share what they know, to help propagate their knowledge and demonstrate health in new and innovative ways. And so I invite you to totally lean into your network a little bit more. It's not just up to you. At the end of the day, you get to create community. And as I said it earlier in one of our talks, like, community is the new currency. And so how do we lean in?
Some questions from the audience. Someone is curious where you both learned about this and creating a remarkable member experience. They say empathy and empowerment is not specifically taught in traditional medicine. So where did you learn? What are some resources to learn more?
It's not necessarily taught in medical school, and nor is it necessarily encouraged by the medical training process. And I have been luckily gifted with lots of empathy in my genetic makeup, which is also challenging at times. So I think when you are a provider who has that inherently, direct primary care is a place where you can flourish and indulge in that. But you also can't just be a bleeding heart, because that unfortunately does not create a remarkable patient experience, or it might, but it won't be sustainable, and then you won't be able to continue, and therefore it won't be, a remarkable experience for long. So, I think that's where the boundaries come in. You have to have that component where you care and you're listening and you're doing a great job, and you also say, and that's the boundary, that's where it is, and that's where we move on, and then we'll connect again on that next week or in the portal or however you're going to go about that. If you happen to be a provider where your empathy bucket isn't so isn't so deep, I think that it does take some time to learn how to do that, because direct primary care does, especially in the retail space, attract quite a few people that are really looking for kind of a provider that they're going to partner with, that's going to listen to them and that's going to be a part of their journey. And so if you're used to just writing a prescription and walking out the door, and that's not the customer that comes into your office, it will be a learning curve. And that pivot of what does this person need, you can actually ask them, how do you like to be communicated? Or how do you like your visits? Or do you like to do things in person? And you can engage your customer in that to say, how can I meet your need? Or what are you expecting? How can I help? What is in your expectation of what we're going to be, how we're going to be working together?
Yeah, I love that. One of the questions that I love to do during an onboarding process is, well, one, I love to do an onboarding process again, right? So a patient comes in, we teach them how to be with the practice over the course of the next year, at the very least. Mm-hmm. So we're future pacing them, like, hey, this is a 12-month commitment for us to get anywhere in what you want to do, right? It takes years for health problems to rear their ugly heads, and it takes time to kind of unravel those things. And so one of the questions that we like to ask is, where do you see yourself in 12 months from now? Because your version of success is going to be very different than the next patient that walks through the door. And when you get to speak to that as a practitioner, or even as the care team members, right? At least we know that we're in line with what that person is thinking. And then other great resources is Delivering Happiness. Zappos is a great company. That's a book that does an excellent job of service. You can always come to the DPC Accelerator if you're a Hint client. We've got lots of things that are coming out to teach you guys about how to engage with some of these tools and resources to help support this kind of build in your practice to engage and retain your members.
I think in the beginning, I read a book. Well, I know in the beginning I read a book, but it was called Switch. And maybe I can find it and post it, or somebody can find it. But I remember reading that book and finding it very, very helpful. It wasn't really about healthcare necessarily, but it was about how the consumer makes decisions. Mm-hmm. And for those of you who've read the book, it's been 4 years, but there's like this elephant, right? And the elephant is like the emotional body. And then there's like the rider, which is our like logical brain, and actually the consumer is driven by the elephant. And so figuring out how to engage that bigger decision maker for the consumer is really an important thing to think about. And when I structured, for example, the menu of my direct primary care practice, I do osteopathic manipulation, and many of our clients, or many of my colleagues in osteopathic medicine will have an initial visit and a follow-up visit cost. And in direct primary care, I had my direct primary care menu, and then I had my osteopathic menu, and I didn't want to confuse the customer. And to the customer, it's like, why is there an initial visit that's more money? That doesn't make any sense. And I wanted clients to look at the membership as the primary driver of joining the practice, not the osteopathic one-off treatments, because those are a part of our practice, but really I wanted that to be partnered with the membership. So I structured our costs so that you're a member, and if you have the membership, then you have a member osteopathic treatment rate. So you see, oh, if I'm a member, then it's cheaper for me to get osteopathic treatment. Great. If I'm a member, that's cheaper. That's great. Okay, I'll do both. So that's how the consumer is thinking. You don't want to get them confused. And well, if you're, 16 and then you become 17, then it's this different, cost. So I think when we think how the consumer is approaching the experience of direct primary care, we may model ourselves differently.
Awesome. Thank you for that. There's been some chatter about burnout, and you mentioned how you can kind of put yourself first and how you set your own boundaries. What are some specific practices that you put into place to put yourself first, Dr. Bree?
Oh, that is such a good question. Well, one of the first things, yes, that is the book, Tiffany. Great. One of the first things that I did is I allowed myself to change when things were not working. So in the beginning, I did text messaging with patients, and many people in the audience may text with their patients and love it, and I did not love it. I found it very distracting, and I have 2 young kids, and I personally have just the brain that if I get a text, I can't not read it. If I read it, I have to respond. And I found myself waiting in line at a trolley in San Francisco, communicating with a woman about her vaginitis by text. And I thought, no, I'm not doing this anymore. This is not going to work for me. I am on vacation, and I didn't feel comfortable making diagnoses over text and sending in prescriptions by text. I don't feel comfortable with that. So I stopped. So I said, we're not texting anymore. So we text administrative things. And if somebody texts in a medical question, we say, you need an appointment, or you can put that in the patient portal where it's private information. And so we just changed. If it didn't work at any point in the practice, then we changed. And again, if texting makes your life better or easier, then great, then you should text. It didn't for me, so I made that change. And repeatedly, every time in direct primary care that it's been complicated, I have to tell myself, why is it complicated? What am I doing? I'm going to make this more simple, actually. So every time I've kind of wound myself up into thinking something, and then you're thinking, how do I do that in Hint? And how do I make that happen? And oh my gosh, why are we making this complicated to make it simple? So I've done that many times, just backed myself up and said, okay, let's make this simple again. Those are a couple of ways that I have created a better self-care in the workplace regimen. And then just having time with my family. I changed my schedule all the time. And for me, as a mom, having supreme control over my schedule is the single most important aspect of my work-life balance. I get to take my kids this afternoon to go horseback riding because that's what we decided to do during COVID. And it's lovely. And I get to go because I decided that I don't see patients after whatever time on whatever day. So with COVID especially, and working from the kid home thing and all sorts of excitement, just having the ability to say, sorry, patients, I don't know anything about the schedule until DPS figures out what's happening with school. Those things are a component of being a working mom that have made direct primary care fill my bucket.
Yeah, we're constantly teaching your patients how to be with the practice, and it's okay for you to pivot and change. I mean, the world is constantly pivoting and changing, and I think the most important thing is how do you communicate it with people so that they know what to expect at the end of the day.
Yep. And often doing that from a place of we are doing this for you also, because when I'm doing it for me, I'm also doing it for you. So we're not saying, oh, Dr. Bree can't figure out her schedule, like, so therefore you can't, whatever. We say, we don't have all our appointments available online right now, but we always have same day availability if you need us. So let us know. If you don't see something that meets your needs, let us know what your needs are and we'll help you meet them. So we're not saying, I don't have the time for you. We're saying, I kind of have to keep my cards close to my chest right now because of COVID and being a mom, but I'm happy to help, and tell me when I can call you.